Hi there, welcome to this video on moderate risk of diabetes foot complications. My name is Tim Mulholland. I'm a podiatrist at Pride Plus Health, and for the last 8 years I've been a clinical academic at La Trobe University as well. I've had a good chance to experience working with both the high-risk foot, the sporting foot, kids' feet, and teaching. So what we're going to go through here is we're going to help you understand just what's going on when you find out that you're at moderate or medium risk of diabetes foot complications, how you can maintain that and how you can reduce the chance of things progressing, and also how do you live the best life on your feet. Let's get into it. There are 3 areas when we're at moderate risk of diabetes foot complications where some things may have happened. The first one, circulation. Circulation is the way that the heart pumps the blood all the way down to the feet. This blood contains all the nutrients that we need for our skin, nails, bones, muscle, everything to grow, and it helps remove the waste products as the blood comes back up towards the heart. With moderate risk of complications, you might have reduced circulation. There will still be enough blood getting down there, but it might not be the same amount as what it was previous. Your podiatrist will give you that very specific advice around what your level is and how to adjust things accordingly. The good things to know is that there is enough, so if there is a break in the skin or if you have a lesion or an injury, you're going to be able to recover. However, things might take a little bit longer than, say, if you did have perfect circulation. All right, now we're going to talk about sensation. This is the nerves of the body. Now, when we think of sensation, pain is one of the most visceral sensations that we think of. Pain, ouch, something is going wrong. And when you're at moderate risk of complications, you might have some impaired sensation. So you may no longer feel pain, or you may no longer feel pain to the intensity as what you did before. Potentially, you could be like, hold on, that's a good thing. If it's sore, I don't want to feel that. Well, where this becomes problematic is pain is also telling us, shivers, Tim, you've got to do something about that. You've got to check your foot. So if we don't have that gift of pain, if our sensation is impaired, we might have a stone causing damage, we might have shoes rubbing, we might have an injury happening on the inside of our foot, but we don't actually know it because we're not feeling it. And so it can progressively get worse and deteriorate without us actually knowing. So when you have impaired sensation, it is very important that we utilize our other senses and need to be able to look, and we need to be able to check on things a little bit more rather than responding or thinking about feet as things that they can tell us the truth about what's going on. An analogy that we can use is they can sometimes become liars. They don't tell you exactly what's happening all the way down there. The final area to touch on here, lesions on the skin. So the lesions that are most common that we're thinking about with moderate risk of diabetes complications, corns, callus. So corns and callus are pressure lesions that build up when you've got excess friction and pressure on the skin. And in a small amount, they're protective, they're okay. But if they continue to build and they press back deeper into the skin, so they go from the epidermis, the outer layer, into the dermis, this is where ulceration and amputation starts. So if you do have corns and callus starting to build up, and particularly if there is an impairment to circulation and sensation, it is really important that we do a lot of prevention and management strategies around that. So let's talk about those strategies. We've got another 3 areas here. We're talking about what we can be doing at home, what we can be doing with our podiatrist, and what we can do with our overall healthcare team. So let's go through home first. We mentioned off the top that you might have some sensation challenges, and it's more important to check your feet. Becomes extra important with those moderate risk of complications. So checking involves having a look and utilising other people who are in the house as well if your feet are all the way down there and it's a little bit harder to bring them up, and twisting your ankle around to have a look and see what's going on underneath your foot. Asking loved ones, could you check my feet? And making a habit out of it, looking for your skin. You want it to be a consistent colour and temperature with what is usual for you. If your skin is quite fair, you want it to continue to be fair. If it's darker, you want it to stay at that darker tones. If you start seeing some redness or colour changes through there, then there's a sign that something is happening and it's worthwhile escalating and having a chat with your foot experts, your podiatrist. Making it a habit of checking at the same time means that it doesn't then become really taxing. It's just something you do. You're not thinking about it, checking. You can use mirrors, or you can use an iPad or an iPhone. Don't know why we're being so Apple branded. You can use any smartphone to use the camera on those as well, so you can actually have a close look at the bottom of your feet if bending is a little bit more difficult. Next up, we're talking about the things that we need to do for our hygiene for our feet, our foot hygiene. Washing, drying, moisturising. Washing is really important, and when we're at moderate risk of complications, even more so. We need to make sure that we're getting in between the toes, and it's not just a matter of the water running down. We're in the shower, the soap and water runs down. Those days are over. We need to be much more careful and much more specific. We should use a soap-free wash because it's got the pH balance the same as the skin. So it can still get a lather up and remove that unwanted debris, but it doesn't make your skin work hard. It allows your skin to be a little bit more soft and supple. It's much more gentle on the skin. So you get your soap-free wash, you lather up, you get on top of the foot, underneath, and in between those toes. Again, if it's getting harder to reach, then you can use some aids. Get a face washer or a long-handled aid that you can pick up from the chemist, and making sure you're getting in and around those toes. When you jump out of the bath or shower, drying and ensuring that we get all of that excess moisture off the skin, very important. Between the toes, just like your mum used to say, dry in between your toes and dry behind your ears. Need to make sure that we don't get moisture lesions building up, some of these fungal pathogens starting to grow. Unfortunately, in my time as a podiatrist, particularly when I've worked in high-risk foot in hospital settings, we have seen people come into hospital with nasty infections because they have not been able to get and dry in between the toes as well as they would like to. Finally, moisturising. Moisturiser is not just for your face to avoid the wrinkles here. It's about keeping your skin soft and supple underneath as well. This is the one time we don't want to go between the toes. We don't want to be adding more moisture there, but across the top of the foot, around the back of the heel and underneath, have a nice consistent time where you're going to be applying that moisturiser. Good time is post-shower or maybe just before bed, so it can become a habit for you to do as well. Your moisturiser should contain some of those natural acids that your skin needs to get, and it shouldn't be just a plain sorbeline, because a sorbeline, particularly when we're at moderate risk of complications, doesn't donate those natural acids and it makes your skin work a little bit harder. Okay, nail care. This is a question we get asked a lot when we see clients if we're at moderate risk of complications, is should I cut my own toenails? Now, if your toenails are very, very healthy toenails and you've still got really good sensation, you've got great reach down there, your eyesight's fantastic, then it's pretty safe for you to do that yourself, as long as you're being very careful. But for most of us, by the time we are at moderate risk of complications, or if we have a bit of a change to circulation, then it's important that somebody else can do it for us. So somebody who can sit close, can use sterile equipment, and can ensure that nail and skin care is taken care of, and there isn't an extra risk of any cuts to the skins or infections and things like that. So for most people with moderate risk of complications, the nail care moves from being something that happens at home to something that happens with your podiatry care team. The sorts of shoes we have on our feet are increased in importance with moderate risk of complications. If our feet aren't as trustworthy, if there's some changes to the sensation, or if there is poorer circulation, we want to protect them even more so. So ensuring that our shoes fit well and they hold on to us as opposed from us holding on to them becomes paramount. You're looking for laces, straps, buckles, things across the top so that the shoe is holding on snug, and the sole should be something that's not too soft and not too hard, a bit like Goldilocks on that bed. You want to make sure that it's comfortable to use and it's appropriate for purpose. If you're going to be walking and running, you want to make sure that you're using that athletic footwear. If you're going to be in the house, you want to make sure that you're using a shoe that's supportive around in the house, but obviously not something that you're going to sweat up or splash in puddles when you're out and about. Speaking of being out and about, your physical health and your physical activities. With moderate risk of diabetes-related foot complications, we need to ensure that our physical activities for our feet are still kept up. Our feet need 30 minutes of cardiovascular exercise every single day. Cardiovascular exercise includes walking, jogging, swimming, cycling. any type of consistent movement where you get your heart rate up a little bit. 30 minutes, half an hour every day, great for the feet, great for the overall health. On top of that, we need to do 2 sessions of resistance training every week. Now, resistance training is weight training. It's where you're going to be loading up your bones, your muscles, your tendons, your feet, so that they can continue to be as strong as they possibly can. When we're at moderate risk of diabetes-related complications, this becomes even more important. If there's not quite enough of the blood flowing down there and we're just sort of waiting for it to occur, we need to encourage that to happen by building strong muscle growth, by fostering and making sure those blood vessels are as elastic and as effective as they absolutely possibly can be. So one of the most important things that we can be doing for moderate risk complications is ensuring that we're getting that resistance activity done twice a week. Lunges, calf raises, squat type exercises, they're the ones that count towards the resistance training. So there's your home team. Now let's talk about the podiatry team. Hey, what do you need to do with a podiatrist when you're at moderate risk of diabetes-related foot complications? Well, the diabetes foot risk assessment should be done twice a year, every 6 months. So this is where you and your podiatrist will be sitting down, you'll be looking at your circulation, your sensation, and looking at the lesion development. Are we getting some changes there? Is there a trend happening, deteriorating, and maybe sending us towards a high risk? Or are we staying along that baseline and things are going really well? You and your podiatrist will be able to talk about that and put a plan in place if there are some changes. You'll also be seeing your podiatrist more regularly for some of the other types of care. We're talking about nail care, as your podiatrist is able to sit close with their sterile instruments and do a nice professional job to make sure that your feet feel as good as they can be and also reduce the chance of these problems occurring. You want to make sure that your podiatrist and you are discussing making sure your shoes are absolutely spot on. If you do have some of these lesions developing, your podiatrist might prescribe shoes or orthotics to try and reduce the rate at which those lesions will develop and stop them from becoming ulceration and amputation and just keeping them at that mild callus type level. You and a podiatrist are probably going to be closer friends when you have moderate risk of complications. And the last team we're going to talk about is something that you and your podiatrist are part of, your overall health team. This is your team who are passionate and supporters of you living the best life that you can on your feet. So there'll be yourself at the centre of it, your podiatrist on the foot side of things, your GP, your local doctor, who will be able to be your pivot, your coordinator of everybody that's going on, provide really important advice and assistance around things. You might have an endocrinologist, another level of medical assistance with your diabetes. You'll likely be seeing an optometrist and having your eyes checked every year, and potentially a dietitian around some dietary advice to ensure that what goes in is appropriate for your diabetes. The final member of a care team at this stage is usually an exercise physiologist. So these are health professionals who've spent at least 4 years at university understanding the human body and how exercise and movement can have a positive impact. So it might be that you need to increase the quantity, or it might be a change in the sorts of exercises that you need to do as well. And this is where an EP, an exercise physiologist, will be part of your care team when you're at moderate risk of complications. Okay, there's been a lot to take in there, but hopefully now that you've managed to sit through this and we've learned about having moderate risk of diabetes-related complications is not the end of the world. We can prevent all of the nasty amputation, ulceration pathways if we do a lot of work with those 3 care teams. Those things that we do at home, the things we do with the podiatrist, and the things that we do with our combined care team of GPs and EPs, endocrinologists as well. If you found this interesting, we've got a few more videos up on diabetes, about diabetes, the sorts of things that are going on, and lots of other content as well at prideplus.com.au. Thanks for tuning in.